topic today is maternal and child health in Africa, the unfinished agenda. Before we delve into the topic properly, I need to remind us all of the Sustainable Development Goals that run from 2015 to 2030. There are 17 goals and 169 targets. These goals come after the Millennium Development Goals that ended in 2015. Goal number 3 states, ensure healthy lives and promote well-being for all at all ages. And target 3.1 of that goal number 3 deals with maternal mortality, and that target says to reduce the global maternal mortality ratio to less than 70 per 100,000 live births by 2030. Target 3.2 deals with neonatal and child mortality, and it states to end preventable deaths of newborns and under 5 children by 2030. Let's remember that goal number 3 caters for the healthy lifespan from the cradle to the grave. The SDG goal number 3 and target 3.2 states to end preventable deaths of newborns and under 5 children by 2030. This really is the unfinished child survival agenda, which is to achieve under 5 mortality of 25 or fewer deaths per 1,000 live births by 2030. Now, the goal number 2, which is not specific for mothers and children, targets ending all forms of malnutrition because malnutrition is a frequent cause of death for under 5 children. And let us remember that all the other 16 goals impact on the health of the mother and the child. In Rotary, we have 7 areas of focus from July this year, 2021. Our 6 previous areas of focus were water and sanitation, economic and community development, maternal and child health, basic education and literacy, disease prevention and treatment, peace and conflict prevention or resolution. The 7th and newest area of focus is supporting the environment. Now in Rotary as well, April, the month of April, is celebrated as Maternal and Child Health Month. It is said if mothers are empowered and healthy, so are their families, leading to an alleviation of poverty and hunger. And the co-founder of the Rotary Action Group for Population and Development, Robert Zinser, said this. Let me give you a few key facts about maternal health and maternal death. In the year 2017, for which we have complete data, 810 women died every single day due to complications during childbirth and pregnancy. And worldwide that same year, almost 300,000 women died from the same complications. We know that 94% of all these deaths occurred in low and lower middle income countries, and most of these deaths could have been prevented. The maternal mortality ratio in low income countries is 462 deaths per 100,000 live births. And when compared to high income countries, which have 11 deaths per 100,000 live births, we see that deaths in low income countries are 42 times higher than in high income countries. Unfortunately, sub-Saharan Africa alone accounted for 2/3 of all global deaths of women. Asia accounts for 22%. We know also that young adolescent girls who are aged between 10 and 14 years are at a higher risk of complications and death as a result of pregnancy. This is, of course, due to the fact that their bodies are not fully mature for delivery. Now, why do women die, we may ask? We know that the days and weeks following childbirth are the critical periods for the lives of mothers and newborn babies. And we know, WHO tells us, that most maternal and infant deaths occur in the first month after birth. These are some of the reasons why women die. Women die of complications during and following pregnancy from the following things: severe bleeding, infections, high blood pressure, complications from heart disease or diabetes, and the four things I have just mentioned account for almost 75% of all maternal deaths. Then comes the case of unsafe abortions, especially in adolescents, as we've said, young girls 10 to 14. And then there are other diseases during pregnancy that can kill women, for example, malaria and HIV and AIDS. We know that 116 million women would give birth roughly every year. So these are 2020 figures. Now, of these 116 million women, 20 million of them would experience some pregnancy-related illness after childbirth. And I've said before that low and middle-income countries, complications from pregnancy and death are the leading cause of death among girls 15 to 19. Unfortunately, we have about 20 million unsafe abortions performed every single year. And a lot of these, over 25% of these, would result in complications. Oh dear, we know that the lack of skilled care is the main obstacle to better health for mothers. We know that in high and middle income countries, more than 90% of all births benefit from the presence of a trained midwife, doctor, or nurse. This is not the case in developing countries, especially in sub-Saharan Africa, where we know that only 51% of women in these low-income countries, only 51% get skilled care during childbirth. And we know that only about half of the pregnant women receive the recommended minimum of at least 4 visits by skilled health professionals during pregnancy. What are some of the risk factors for women dying? The main risk factors are the following. The first one is poverty. The second is the distance from the woman's home to a health facility. The third is the lack of information. The fourth is inadequate and poor quality services. And the fifth is cultural beliefs and practices. You can unpack each of this and you will understand why women die. We have what we call the 3 delays, which are risk factors for women who are pregnant. The first delay is the delay to decide. Should I get health care? Should I go to hospital? Am I sick enough to warrant to be seen? That's the first delay. The second delay is to get to the health facility. From where the woman is, can she get there? Does she have money for transportation? Does she have money to buy medication? And the third delay is the delay to receive appropriate care. When she does get to that health facility, is there enough in that health facility to cater for the complication that she has? Is there enough in that health facility in terms of human resources, in terms of medication or lab supplies? Is there enough to provide adequate care for this woman? Now we have talked about women's death and health. Let's see some key facts about child health and child death. It is a truism. People say it all the time. Well, children represent the future. But when you see how children are treated, you do not believe that they represent the future. Neonatal period, which is the first 28 days of life, is critical. Childhood, when we mention childhood, is when we talk about the first 5 years of life. Now, newborns are particularly vulnerable because the risk of dying is highest in the first 28 days of a child's life. And newborns and children are vulnerable to all kinds of things, starting from malnutrition to infectious diseases. Let us know that children in sub-Saharan Africa have the highest under 5 mortality rate in the whole world. Children in sub-Saharan Africa are 14 times more likely to die before the age of 5 than children in developed countries. Some more facts. We know that in 2019, 47% of all under 5 deaths occurred in the newborn period. That is in the first 28 days of life. We know that about a third of the children die on the day they are born, and 3/4 of them die within the first week of life. We are saying it again, Sub-Saharan Africa has the highest neonatal mortality rate it had in 2019, which was 27 deaths for every 1,000 children born. We are only followed by South Asia. And you can see that the data given has different years, where we only see what we record. So the years I am citing are the years for which either WHO or other agencies have complete data. Of the 10 countries, I must say, worldwide with the highest neonatal deaths, of the 10 countries worldwide, 4 of these countries are in our Rotary Zone 22. And these countries are Nigeria, Ethiopia, Democratic Republic of Congo, and Tanzania. And these are 2019 data. Oh, it is also to be said that children are at a greater risk of dying before the age of 5 if they are born in rural areas, if they are born to poor households, or when their mother doesn't have basic education. Like we talked about women, why do children die? There are causes of child death in the first 28 days of life. Either they are born prematurely, or they had some complications while they were being born, or they have infections or birth defects. Secondly, there are some childhood diseases that kill children. Measles, polio, diphtheria, tetanus, pertussis, pneumonia from Haemophilus influenza type B, and streptococcus diarrhea due to rotavirus. Interestingly, all the diseases I have listed above are vaccine preventable. Now, these are not the only causes of death in children. We have other emerging priorities, which include congenital anomalies and childhood cancers. What are some of the risk factors that lead to children dying? Low birth weight. If at birth the child is not the weight it's supposed to be, that child is at a big risk of dying. Malnutrition of children. Non-breastfed children, and this is an important factor because breastfeeding is known to be the best feeding for children for the first 6 months of life. Overcrowded conditions are others which promote the spread of disease. Of course, unsafe drinking water, unsafe food, poor hygiene. The picture that I have on the right shows you a body of water where families wash clothes, where families bathe, and where families carry water for drinking. So you can imagine if a newborn is subjected to that kind of water. Just to let you know that essential newborn care is critical for a child to thrive in the first year of life, the first month of life. I have mentioned it again, early and exclusive breastfeeding is necessary. Now, what are some of the challenges to maternal and child health in our District 9400 and in Zone 22 as a whole? Because all of Sub-Saharan Africa falls under Zone 22, and we all have similar challenges. The World Health Organization states that we have weak health systems, and there are 6 pillars to the health systems. The first is inadequate service delivery. When you go to a health facility, are services that are provided, are they adequate to maintain health? The second is weak health information systems. We don't have appropriate data. Lots of places don't record births. They don't record deaths. They don't record the cause of deaths. So when you're looking for data for why people have died, you can't have them because they are not recorded. Thirdly, we have inadequate human resources. Either the number of human resources is inadequate, or the skills that they have, they are poorly trained, or the distribution of these human resources, where we know in many countries, most of the human resources are centered in the big cities and towns, and you go to the rural areas and there are no people, no health workers. Fourthly, insufficient funds for health. In the year 2000, African ministers of health and the governments agreed to allocate 15% of their national budgets to health. Sadly, in the year 2021, we don't have up to 10 of the 54 countries who fulfill this agreement. Fifthly, inadequate medical products. Do we have medication? Do we have stockouts of vaccines? Do we have enough technology in the hospitals and centers to maintain health? Lastly, but certainly not the least, weak leadership, weak governance. Corruption is prevailing in most of our countries. Monies allocated to health are diverted or used for other things. These 6 pillars of the health system are weak in most of our countries in sub-Saharan Africa. Now here is where Rotary comes in, because Rotary makes help happen. Rotary does certain things. As a voluntary organization whose motto is service above self, Rotary provides or supports the following: education, not only classroom education, but education of communities about how to make mothers and child survive. We provide support to immunization. You all know about the polio immunization. We've been doing this for over 20 years. Rotary provides or supports birth kits for clean deliveries. In some countries, Rotary even provides mobile health clinics to serve communities. Now, Rotary helps in keeping children alive, and the biggest part of this is immunization. In many countries, especially in our district here and neighboring districts, where malaria is a serious problem, insecticide-treated bed nets are offered. I have a picture at the bottom which shows a man bottle feeding a child. When a woman cannot breastfeed, bottle feeding is the other alternative, and nothing says that only a woman can bottle feed. Even men and fathers do. Rotary supports sustainable programs. We have just learned of the program of scale for malaria prevention in Zambia for millions of dollars of Rotary. Many countries in our zone and in our zone know about Rotary Family Health Days. Action days which provide support, free care to communities which usually would not have access to care. So what are some recommendations for maternal and child health in Rotary Zone 22? We should continue to support the strengthening of all 6 pillars of the health system, especially quality of care. And we must ensure that universal health coverage and equity exists, which means everybody in that country should have access to health care as close to their home as possible. We should support the prevention of unwanted and too early pregnancies, which means we need to have talks with the youth to tell them how to prevent unwanted pregnancies. One time, we should continue with vaccination for children and for pregnant women. We must support adequate and appropriate nutrition. We must support exclusive breastfeeding. And of course, we really need to support adequate sanitation and hygiene. This is one of our areas of focus. The SDGs say, leave no one behind. And Rotary needs to rally behind these SDGs so that health care is provided to one and all. We need to identify underserved communities and marginalized groups. And I talked about data before. We need to encourage countries to use data, to collect correct data, and to disaggregate data by age, by sex, by wealth, by education, by gender, and other human rights considerations for all populations. This is the month of maternal and child health for Rotary. I thank you.